When FP 2020 was launched in 2013, we had a simple goal: to increase the number of people using family planning in some of the world's poorest countries, free from coercion, in order to ensure that women could participate as equals in society. That target was 120 million new users by 2020. In the decades since, the number of family planning users in these 69 initial countries has grown to 371 million, a growth rate that was accelerated by the combined efforts of nations, civil society, international NGOs, youth leaders, and donors. Thank you all for your combined efforts and for your leadership. Our partnership is strong. Our partnership, ladies and gentlemen, delivers results. This is not just FP 2030's success. It is a collective effort from a range of partners across the support network. But even as we celebrate our success, we know there is more that needs to be done. Today, 218 million women in low and middle income countries want to avoid a pregnancy but are not using any modern contraceptive method. 800 women are dying every day in childbirth. And globally, we see efforts to roll back access to sexual and reproductive rights. These issues are concerning. If our global partnership doesn't start doing business differently, we will miss the targets that are set before us for sustainable development. And many hard-won victories are going to be lost, and they are at risk. Access to reproductive and sexual health care is under threat, colleagues. And FP 2030's work is more important now than ever. This is why we need a fresh approach. Last year, after consultation with stakeholders around the world, FP 2030 moved to a more local model with 5 regional hubs on 4 continents in order to shift the balance of power in our partnership. We place countries in the lead, and we develop commitments in a culture of transparency, inclusivity, and accountability. As we move forward, we will continue to build on our regional model. We are centering the needs of youth and other marginalized and stigmatized identities within their communities, as we believe that if family planning is easier to access and inclusive of communities that face the most significant barriers to care, access will be made easier for everyone. FP 2030's new strategy has 7 priority areas. 1. Advance recognition of family planning by expanding partnerships and leveraging the 2030 agenda. This would ensure family planning is seen as a catalyst to global development. 2. We will promote increased, diversified, sustainable, and efficient use of sexual and reproductive health financing. This would ensure that funding gets to where it is most needed and used in an efficient and sustainable way. 3. Prioritize the needs and rights of adolescents and youth, marginalized and stigmatized groups, as equal, meaningful partners to improve access to SRH services. There are more than 1 billion young people in FP 2030 countries. Engaging directly with them has a triple impact on the adolescents they are today, the adults they will be tomorrow, and the families that they may choose to have. 4. Supporting the scale-up of evidence-based practices to accelerate our impact. By implementing practices that have proven success, we can replicate the results for the biggest impact across the areas where FP 2030 works. These 4 priorities will be underpinned by an additional 3 foundational and cross-cutting priorities. These include resourcing communities to solve local issues, leveraging and expanding the use of data for evidence-informed decision-making, and lastly, ensuring that as an organization, we strive to constantly improve our own performance for better results. Universal access to sexual and reproductive health is a human right. It is foundational to global development. FP2030, working with our partners across the globe, will continue building a world where everyone, everywhere, can make their own decisions about their fertility, working with our partners to shift power to national and local decision makers. This underpins our whole strategy that focuses on better accountability, more effective advocacy, data-driven decision-making, and more importantly, inclusive commitments.